Thanks for staying with us. Yesterday, November 14th, was World Diabetes Day, and this year's theme is Education to Protect Tomorrow. According to reports, over 10 million Nigerians have diabetes, and it has killed more than so many people than COVID-19 or even cancer. The reason why we discuss this every single year, we touch on diabetes, and it's important because we can never stop talking about health issues. With us today is a chief consultant, endocrinologist and diabetologist, Federal Medical Center, Abeokuta, Ogun State, Nigeria Center Coordinator. We have with us Dr. Adeshina Olubiyi Fidelis. Welcome to the show, sir.
Good morning. Thank you for having me.
Have you, sir. Diabetes, as I said, we discuss this every year, but it's always important to always bring it back to the fore because Nigerians must not forget on how to ensure they are able to take care of themselves in this condition. Could you tell us again, what is diabetes and how do people get it?
Okay, thank you. Actually, the full name is diabetes mellitus. The diabetes means a siphon because of how people who have diabetes, the symptoms they come with. Water comes in at one end, comes out at the other end. That's diabetes. You're acting like a siphon.
Okay.
You're drinking water, you're urinating, you're drinking water, you're urinating. And the other word, mellitus, means as sweet as honey. If you taste the urine of the individual with diabetes, it is as sweet as honey.
Wow.
So that's where the name comes from, diabetes mellitus.
Okay.
So that is diabetes. And diabetes is said to occur when the blood sugar level of an individual rises so high that it gets to a level it starts coming out in the urine. Normally, we have a hormone, a sort of chemical produced by the body that controls the blood sugar level. It is called insulin. So when this insulin is not produced at all, or when it is produced and it is no longer effective, then we have diabetes.
So we have two types. We've always heard that some people are born with one, a type 1, and then there's a type 2, which has to do with nutrition. Could you please?
Okay, yes, more than 2 types, really. Okay. We have what we call type 1 diabetes. We tend to see this in young people, although we can also see it in adults. That one occurs when the body's immune system recognizes the pancreas. It is the pancreas, the human pancreas, a portion of it that produces the insulin. But when the human immune system sees the pancreas as a foreign object, it begins to attack it. The function of the immune system is, if a bacteria enters into the body, bacteria enter into the body, the immune system is supposed to counter it. Yeah. But when the body starts attacking itself, as it occurs in type 1 diabetes, then the insulin-producing cells are destroyed. That's type 1 diabetes. In type 2 diabetes, which is the commoner type, that forms about 90% of all people with diabetes. We tend to see this in adults, but we are now also seeing it in children. That has to do with obesity.
Right.
The bigger you are, the more overweight you are, if you're obese, there's a high risk that such an individual will develop type 2 diabetes. Yeah. And then we have what we call the other specific types of diabetes. You see this in people who abuse alcohol. Alcohol directly damages the pancreas, damages the liver. You have people who have other conditions. Let's say there's an individual with hypertension that you are treating. There are certain drugs that we can use to treat hypertension that can trigger diabetes.
Wow.
I mean, there are some drugs that people are abusing. Quite a lot of Nigerians abusing those steroids. I have arthritis. They said I should go and use prednisolone. If you use prednisolone, yes, the pain of the arthritis will go, but you're going to acquire diabetes, you're going to acquire hypertension.
Wow.
And you see people abusing these drugs. And then the other type, it's we say it's hyperglycemia, and that means high blood sugar that we first see in pregnancy. So in the pregnant woman wasn't diabetic prior to pregnancy, gets pregnant, can develop diabetes. But we also know that women who had diabetes prior to pregnancy, the diabetes can also continue in pregnancy.
Okay, doctor. I've seen people who were able to come out of the type 2, survive the type 2 diabetes by a change of either diet and some other things. And that is the most prevalent type of diabetes now.
Yes,
So
indeed.
tell us, for people who are struggling, who are still, testing and are a bit in between, or they have been diagnosed of type 2 diabetes, what are some of the things they can begin to do to probably reduce or take it out entirely?
Yes. Type 2 diabetes sometimes is referred to as a disease of affluence. That's okay if you're rich and you're living it up and
the soft life.
you're not watching your diet, you're not exercising, you're adding so much weight, then you may develop diabetes, type 2. So we know that type 2 diabetes you can prevent. We just don't move from normal blood sugar to diabetes. There's always a midpoint, which is reversible. We call that pre-diabetes. That's why we encourage people, please, once in 6 months, once in a year, check your blood sugar level. Because if we get you at pre-diabetes, all we need to tell you is, please shed some weight, please start exercising, please start watching your diet, go back to that traditional African diet, high in vegetable, high in nuts, rather than all these energy-dense foods of pastries and all that. So if people do make such changes to their lifestyle, start walking, we say, please ensure that at least in a day you take 10,000 steps. But if you do come out from your house, you get into your car, you get to your office, take the lift. I got to the train station yesterday. I would say 90% of those of us that are disembarked got on the escalator. Only about 10% of us went up the steps. I mean, such opportunities, you should be walking.
Okay.
I mean, those are steps to take too.
Is diabetes necessarily linked? Because, you talked about the affluent condition that it was now.
Yeah.
Is it necessarily linked to overweight? And is it, you also mentioned that, the pancreas is a great source of the balance or imbalance that, causes diabetes. So what exactly would you say, aside alcohol that you said was a direct, are there any other kind of food that affects the pancreas in such a way that, because in our regular diet, things are common amongst us that you should be careful of?
Okay. We talk about sugar a lot, and I think I need to explain the causal relationship between sugar and diabetes. The truth of the matter is that you can eat all the sugar in the world and you may not develop diabetes. And you may not have touched sugar in your life and you may develop diabetes. So we talk about what we call risk factors. Why do people develop diabetes? Number one is heredity. I mean, you see that we resemble our parents. So if there's a father who has diabetes, you have inherited your genes from your parents. So you are also likely to develop diabetes if, there's a big if you do not watch your lifestyle. The fact that you inherited such genes does not mean that you must develop diabetes. No. It is if you have a gene and then you give an enabling environment to that gene to manifest itself, then you will
Let's talk about maintenance, because Nigerians are always fearful. Abroad you have insurance that can always sort it out. here, people are scared of how much it costs to maintain this disease or to even manage it. So they rather just, what I don't know will not hurt me. So even though I might have it, but I just rather stay home. It's expensive to manage diabetes.
Yes, and that is what we're trying to get out. And thank you for a platform like this. It is expensive to manage diabetes in Nigeria. As you said, health insurance, it's only about 4% of people who are on it. And so majority of Nigerians who have diabetes have to pay out of pocket. And it's unfortunate, the type of medicine we practice, the type of drugs we prescribe, it is what you can afford. There are very good modern drugs to treat diabetes. There are certain injections that, you just need to take 4 times in a month. It will help control your diabetes. It will help control your weight. But each pen, I brought a sample here, will cost you 155,000 naira.
Each injection?
Yes, that's a modern medication.
You gotta take that 4 times a month?
4 times a month. So, no, the whole pen, 4 times a month, yes. How many Nigerians? The vast majority of the people we see with diabetes, type 2 diabetes and that, are elderly retirees. So you as a doctor, you get frustrated at times that, so what type of drug are you going to prescribe? I mean, they tell you, I've not received my pension in 3 months, so are you going to prescribe an injection of 100? And so you will go back to those old drugs that have more side effects. Yes, they are efficacious, but we do have issues like that. So it is expensive. Look at a vial of insulin. For those who require insulin to control it's averagely, it's about 6,000 naira. And depending on the dose the individual is on, may require about 2 in a month. And diabetes doesn't come alone. It tends to come with hypertension. It tends to come with abnormal cholesterol levels.
Wow.
So you have these individuals on drugs to control diabetes, drugs to control hypertension, drugs to control cholesterol level, drugs to prevent a stroke, drugs to prevent kidney failure from the diabetes. So
it's kind of scary getting old in Nigeria, especially.
Yes. So it frustrates you as a doctor that, this individual, what can he or she afford?
See, you've just scared us. And, as Mariah said, getting old in Nigeria. And so the theme for this year is access to education.
Yes.
So we need, and a lot of times when we see our elderly ones, we see them taking all sorts of drugs. And this, what you have just said, explains it. Is there any sort of access to education that one can get in your youth or before you are an old retiree that can help you in your old age so you're not,
yes.
going to hospital and taking all these drugs?
Yes. Education to protect tomorrow. I mean, that's our theme this year. We do know diabetes is a condition that the more the individual with diabetes knows about the condition, the better the outcome.
Okay.
Because most of the time, you are your own doctor as an individual with diabetes. At most, you see your doctor 4 or 5 times a year. But most of the time, diabetes is about self-care, the way you care for yourself. So we try to get a lot of information across to the person with diabetes. This is what you should do about your diet. This is what you should do about exercise. So we tell young people from now on, inculcate exercise into your life. If you exercise, you're not likely to go wrong. So people with diabetes should exercise. People without diabetes should exercise. Those who plan our towns and cities and estates should make a place for people to exercise. To walk safely,
Sir, I want to say something. But I'm just trying to choose my words carefully because I don't want the ladies to back at me for this. But I've always had a theory that a lot of our rich people in Nigeria, maybe they don't know how to expend their money. So some of them have money and they do good work. You know, they'll just say, okay, I'll give you $10 million to internet displaced persons. I'm going to give $10 million. You know, this blanket philanthropic gestures, which are great. But sometimes it seems like the doctors are not articulating the issues properly. So that when we have people who actually want to give, they know where to give. Because imagine if I was a very rich person now, I would like to give $1 million to some kind of diabetes organization that can make these injections available for regular Nigerians. So what would you say as a doctor? What is on ground for people who want to give, who want to support diabetes? How can they access to help in this situation?
Yes. In Nigeria, there are a lot of not-for-profit diabetes organizations. Olubiyi Diabetes Center, as you are aware, we're not-for-profit, and we have done a lot in diabetes care in Ogun State. We got a grant, $100,000 from the World Diabetes Foundation. And what was it for? It was to educate primary healthcare workers on diabetes care, to equip 300 primary healthcare centers in Ogun State with basic diabetes equipment, so that people can access diabetes care right there at the primary healthcare center. And primary healthcare center is supposed to be the closest to where people live.
Are the Nigerian-based organizations supporting you?
Yes, we work in conjunction with the Olubiyi University. We work in conjunction with the Remo North local government, you know, to bring diabetes care close to. So yes, a lot of, and we have the Diabetes Association of Nigeria. That's the leading not-for-profit organization. I chair the Ogun State chapter.
Is it enough?
No, it's not enough. We welcome more people because there's a whole lot to do. In 2020, from the International Diabetes Federation, the statistics was that 60,000 people, Nigerians, died from diabetes, both diagnosed and undiagnosed. And as you said rightly, about 5 million Nigerians are living with diabetes, diagnosed and undiagnosed.
Kindly tell us. Answer.
So, today being yesterday being the World Diabetes Day, what exactly are your activities that are geared towards this advocacy?
Yes, just like what we're doing here, the platform you've given us, let's get the message across to Nigerians that you may have diabetes and you may not know. You may have no symptoms.
Are there some checks happening presently?
Oh, yes. Across the country. Yesterday, all of this week, we're going into hamlets and all over the place, telling people what the symptoms are. Also telling the people that there may be no symptom and you may have diabetes. So please come and check your.
That's even more scary.
Your blood sugar level. And I mean, just in a word about diabetes in the pregnant woman. You know, we have seen a lot. And once you see a woman delivering a baby dies. Delivers, baby dies. You know, the Yoruba cosmology is that, it's an abiku. No. It may just be that woman has diabetes. During pregnancy, that baby is in an ocean of sugar. But once it's delivered,
there's no sugar.
There's no sugar. The sugar goes down drastically. Within 24 hours, the baby, the baby is dead. So we want to tell women like that, once that's noticed, until proven otherwise, that woman has
We have to wrap up.
Yes.
I think what I've learned from you today, aside from all the other things you said, is the fact that there are some people that come to your office and you understanding and seeing that they cannot afford the kind of drugs that could actually help them solve cure this. You have to prescribe something lower for them. And that is a need. So we always use this platform to express to many people out there, philanthropists out there, that there is a need. Diabetes organizations across Nigeria where we make these drugs available to regular Nigerians who can't afford it. I think that's a noble cause, and I thank you, sir,
yes,
for coming to share this with us today.